Crawling, standing, walking, running. Most children accomplish these tasks within the first 2 years of life. Blakeney Moore was no different. At least that's how things appeared. On a visit for her brother's broken foot, Dr. Al Gilpin, a pediatric orthopedic surgeon at McLeod, noticed something wrong with Blakeney's walk.
He was watching Blakeney run around the room, and he called the nurse in and said, "I need to get x-rays right away." And we just weren't quite sure what was going on, but we could tell by his demeanor that this was something pretty serious.
At that point in time, I was very concerned about her hips. We ended up getting x-rays of her pelvis and realized that both hips were out of the socket.
They called us back into his office, and he explained to us that Blakeney had bilateral hip dysplasia, which is when the ball and socket are not fitted together correctly to form the hip joint. But hers was malformed from birth. Dr. Gilpin said, you know, I've never seen anything like this. This is highly unusual, but I encourage you to get a second and a third opinion. He said, go home and pray about it, talk to your family about it, see what you want to do, because it entailed multiple surgeries, being in a spica body cast, which would come from her chest all the way to her ankles, and she would be immobile for 3 months for one hip to be corrected and another 3 months for the other hip to be corrected.
First thing you have to do is you expose the ball in the socket. As you might imagine, the ball is not in the socket, so we had to rebuild the ligaments and tighten up the ligaments around the ball to keep the ball in the socket. The other thing we had to do is, because all the muscles and ligaments in the leg had gotten tight or adaptively short over time, we had to make an incision on the side of her leg and cut her thigh bone and actually shorten the femur so it would not place excessive pressures on the hip itself. And the other problem that happens is, because the ball was not in the socket never developed into a round socket.
Initial surgery was about 3 hours long, and then Dr. Gilpin had to go back in and make some adjustments, and so it was another 2 hours, about 2 hours. And then she was in the PICU, the Pediatric Intensive Care Unit, and they did a great job. They were very attentive. Any questions I had, they were willing to answer the questions. But it didn't end after the left hip was corrected. There were still problems going on. Blakeney had to learn how to walk again.
She had to have therapy significant therapy for a long time.
I thought the surgery was going to fix it, but then you have therapy that has to occur, which seems even harder on the family at that point. You have to walk away because the therapist is stretching her, and I'm sitting here crying just as hard as Blakeney's crying.
Blakeney endured 6 surgeries and 1 year of physical therapy. Today, she's a vivacious 6-year-old.
She's never in any pain now, and she runs and jumps and rides her bike without training wheels now. She's a normal little girl.
But these are wonderful twin boys. They are 8. This is Harrison and this is Will. And we are so incredibly thankful to McLeod. Not once, not twice, but 3 times have they saved Harrison's life. From our NICU days, they were born 8 weeks early and they were in the NICU for 45 days. When Harrison was 30 to 33 days old, he had a struggle with breathing, and Dr. Harlan saved his life then. Between the 2 boys, this past year in April and May, they had 9 cases of strep, and so we realized that we had something going on with their tonsils, and they saw a wonderful ENT, Dr. McKay, and he recommended that they have their tonsils and adenoids out.
The tonsillectomy is one of the most common surgeries performed during childhood. In the last 15 years or so, the number of tonsillectomies performed in this country has roughly doubled. The reason for the increases in this surgery is that now we're paying much more attention to how kids are sleeping.
This past summer, when I woke up, my mom said that blood was coming out of my mouth.
That morning he woke up and he'd had a little bit of blood on his pillow and a little bit of blood on his face, and so I knew that he had been bleeding during the night.
Tonsillectomy does have risks, and unfortunately roughly 2% of the time, children can develop bleeding. Most commonly, this occurs about 1 week after the surgery has occurred. And in some cases, we think what happens is that when that initial healing scab falls off, there can be a very small blood vessel just underneath that scab that starts bleeding, usually just a little bit. But in some cases, it can be persistent enough that we have to take a child back to the operating room.
We didn't call an ambulance because we didn't know we had an emergency until we got to the driveway and all the blood started coming up and out. And even though it was 6:30 in the morning, everybody responded like that.
And in the ER, a nurse was sucking all the blood out of my mouth, but there was a really big problem when it happened. There was a big scab of blood in my mouth, and my mom told me to lay back straight, but that big scab of blood was blocking my throat, so I couldn't breathe if I lay back straight.
It was a pretty active area. There were people coming and going, and everyone, there was some, you could tell in the tones that it was urgent. I mean, no one was flipping out, but you could tell that it was serious.
I guess you do think, you know, my child could die, and you know, I was thinking about his twin brother. I was thinking about all the blood that I knew he'd already lost.
After Harrison was stabilized in McLeod's emergency department, he was rushed to an operating room where Dr. Dan Hopla was waiting to perform surgery.
Once we got him asleep and intubated, the biggest risk at this point is putting him to sleep and getting the tube in the throat because you've got blood in the airway and you don't want it going down the lungs. After that, you have to find the bleeding point and then control it either by electric cautery, suturing, or pressure, or a combination of the above. You know, one of the things this case emphasizes, this McLeod's and the doctors I work with is sort of a team. If something goes wrong, there's not one person here in the middle that's going to do everything. We needed help. The operating room, everybody cooperated and got things done in a timely and judicious fashion, so this increased the chance of a good outcome.
We didn't realize at the time how serious it really was because everything went so well, and McLeod had everything that they needed to make it run well. It's not always just luck. I mean, they were ready for it, and I won't ever stop appreciating that.
We believe in miracles.